Good afternoon, and welcome back to HealthLeaders, the Winning Edge program, a weekly series of webinars touching on the topics and strategies that you need to know most. My name is G. Hatfield, and I'm the CNO editor for HealthLeaders and will serve as your moderator for this session. I'd like to apologize for not being on camera today. I am having some connectivity issues, so you'll just be hearing me with my audio. Today's webinar is titled The Winning Edge for Overcoming Key Barriers to Virtual Nursing Adoption, and it's sponsored by Collette Health. Thank you so much to our sponsor for making today's program possible, and to you and our audience for participating. Before we get started, for those of you participating in the live program, I have a few housekeeping details. Our program will be approximately 60 minutes in length. Note that an on-demand version of this program will be available on our YouTube channel on Friday and can be accessed through our website, healthleadersmedia.com. To ensure that you can see all of the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Next, you will find a resources list for today's webinar on the upper right hand of your screen. Here we have listed the webinar slide deck for you to download along with supplemental resources from our sponsor. Additionally, you will find a registration link for future The Winning Edge events. At the bottom of your console are multiple widgets you can use. To submit a question, click on the Q&A widget. It may be open already and appear on the left side of your screen. You may submit questions at any time during the presentation. However, please note that it is likely that your questions will not be answered until the Q&A portion of the program. Finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. At this time, it is my pleasure to introduce our panelists. First, we have Dr. Christine Gall, who is the Chief Nursing Officer at Collette Health. We have Yuri Mykoo, who is the Senior Vice President and Chief Nursing Officer at Tampa General Hospital. And last but certainly not least, Laura Rashleger, who is the Vice President of Nursing Operations and Virtual Nursing at Advocate Health. So thank you all for joining us. And with that, let's get into our discussion. So first, I'm going to have each of you tell me a little bit about yourselves and your health systems. If Laura, you want to get us started.
Yeah, thank you. Good afternoon, everyone. So Dr. Laura Rashleger, I work for Advocate Health, the Vice President of Nursing Operations and Workforce across the enterprise. We are the third largest not-for-profit organization spanning multiple states and 70 hospitals across our footprint. I've been a nurse for 20 years and certainly in various progressive leadership roles, but really enjoy workforce optimization, innovative care delivery models, and strategic leadership. So thanks, Chief.
Absolutely, yeah. And Yuri, what about you?
Hi, my name is Yuri Mykoo. I'm the Senior Vice President and Chief Nursing Officer at Tampa General Hospital, one of the hospitals in Florida Health Sciences. We have 5 hospitals and manage a 6th. We are integrated health delivery network. We're an academic teaching facility, level 1 trauma, stroke, neuro, and burn center. We're a safety net hospital here in this community, and I've been a nurse for over 20 years. I certainly enjoy new opportunities, improving technology, strategy, growth, and developing new systems in our hospital system.
Absolutely. Thank you, Yuri. And last but not least, Christine, what about you? Oh, I believe you might be muted, Christine.
Thank you. Good afternoon, everybody. I'm Christine Gall. I'm the Chief Nursing Officer for Collette Health. We are a technology company that helps hospitals keep patients safe and staff supported through a virtual care platform. And our platform is truly an integrated platform that allows for virtual nursing, virtual observation, as well as workforce support. My role at Collette Health is to partner with our partner organizations to ensure that we are designing and developing nursing, virtual nursing, and workforce solutions that address key pain points. So very happy to be here.
Absolutely. So with that, let's get into our topic. So as all of you probably know, AI and virtual nursing aren't just on the horizon for many health systems. They've already arrived. Both technologies promise improvements in efficiency and time given back to nurses at the bedside and relief from documentation burdens. But both also mean changes in workflow and education for bedside nurses. Also, there are many routes to implementation that will have different outcomes that leaders can choose from. So as AI and virtual nursing become industry standards, CNOs and other healthcare leaders must develop strategies to overcome obstacles and ensure the sustainability of this technology. And so that's what we're going to talk about today. So my first question for all of you is, what are some of the biggest barriers to AI and virtual nursing implementation that health systems are struggling with? If Laura, you want to get us started.
Oh, this is a great question. I think, so many of us can relate to. So I'll start by kind of an obvious one, but really wanted to get it out there. Workforce skepticism, I think, is one. And also the lack of nursing involvement is sometimes common with that. So certainly with that, it's change management. Sure, budget is a challenge as we navigate through, budget neutral execution and deliverables, but change is definitely the hardest. It can be fun, it can be exciting, AI, virtual nursing, lots of buzzwords out there in the industry. But I think from our amazing nurses at the bedside all the way to the C-suite, it's really taking them alongside you with implementation. And we have to explain that why early on. So involving them from professional governance through the integration and implementation is really, really key. And then I'll just add cost, because it's also, I think, an obvious one, is that, we're adding technology, which does come with a price tag. So, the how and what of we're doing with virtual nursing and AI is really important to have that ROI. So taking that falls, readmission, the nurse sensitive indicators, and really being prescriptive and precisional about measuring is really key to overcome those barriers. That's a great question.
Absolutely. Yuri, what are your thoughts?
I would agree that one of the things you're always looking at when you're asking your CIO for some new technology is validating what that ROI is going to be. I would say look for all the opportunities that you have. I mean, there's a couple of different options, whether it's fixed or mobile, and see which one fits your system the best. I would say making sure that the team has a chance to sit down and understand what you're trying to implement and why, and get their feedback. I think when we started implementing virtual nursing, we specifically started with some advanced work on one unit. We sat the team down and we put them together with the nurses that were going to be on the other side. And we said to them, how do you want this to look? How do you want this to work? How is this going to benefit you? Write down all the questions and then start small, focus in on those areas, and then work your way up. I think that's the best way to do it, to gain their engagement, because they're helping to design the process. And what they help to design, they're usually bought into.
Mm-hmm. Absolutely. And Christine, what are your thoughts? I think you're muted one more time, sorry.
Sorry, my mic, it seems, goes on mute by itself, so I apologize for that.
No worries at all.
Yeah, so I agree with what both Laura and Yuri said. Staff buy-in is optimal and paramount to a virtual nursing program and successful execution. And I think a place to start to ensure that is overall readiness of the team that you're asking to implement the change. And there are various tools that you can look at to determine readiness, but that's a really great place to start. It's also really important to ensure that the team that is established to support that change and to make those key decisions is properly resourced, and that there are leadership supports in place to ensure that iterative change that is absolutely necessary is occurring. So when we talk about, implementation of virtual nursing, and then to also a layer on top of that, we've already spoken in detail about how you do it and the importance of change management. I think another important piece is that whole AI component, and recognizing that this is all new territory for us all. and we all need to make sure that we are aligned both from a regulatory perspective, from a risk mitigation perspective, and that organizationally we have the most effective governance structures in place to ensure that all stakeholders are confident and comfortable with the use and where AI technology is leveraged. So I love this discussion. It's a really foundational piece to implementation of virtual care.
Mm-hmm. Absolutely, yeah, and we're definitely going to discuss change management in this session, because I think, as all of you are saying, that's really key anytime you introduce something new to the workforce, but especially new technology. So my second question for y'all is, how should CNOs go about selecting and implementing AI and virtual nursing technologies to make sure they align with clinical goals? If Yuri, you want to get us started.
I think a great idea is we have governance on all of our units, and we usually seek feedback and advice from the teams on where they are having the most struggles. And on our technology team, we have the opportunity to share that with the technology team as they bring it up in the councils. Here's where we're struggling. Here's where we have an opportunity. Here, do you have any solutions for this? And then what we do is we investigate what those opportunities are, and then seek the technology that matches those different items that they brought up. We always look for the teams that are the go-getters, the ones that want to try first. And I think every team has the early adopters, then they have everybody that drags along, and then you have the ones that come along after their skepticism has been put to rest. And so we have a bunch of teams like that like to be the first to do everything, or they want to be the first to give it a shot. And educating them and working with them on what those technologies are, I think, is the biggest plus for us.
Mm-hmm. Absolutely. And Christine, what are your thoughts?
In addition to everything that has just been mentioned, I think it's important to really start with a very laser-focused vision and goals for what the virtual care program is going to do, and make those goals known. In absence of that, in my experience, individuals and key stakeholders tend to make up their own thoughts about what that might be, and that can cause some misalignment. It's important also that those goals for the program also very closely align with the strategic priorities that are in place in the short term and the longer term future. And that as the nurse champion over that program, that you have appropriately aligned and ensured that you have secured the support of your C-suite colleagues, that you are planning for when they get engaged, when those check-ins happen, even ensuring that they are armed with the stories and the learnings as you go along, which are obviously part of that iterative program and process. It's important to focus on a top pain point, but also something that will allow you to establish an early win. So you're not going to start probably with the most complex issue. You'll start with something that is important yet achievable. Then identify and develop the project and program champions, both at the leadership level and at the staff level. And it's very important as you convene your work team, as has been previously mentioned, that is heavily comprised of staff who will be responsible for implementing the change. If you are able to establish champions at the staff level, you have really removed an incredible barrier because they will be able to help their colleagues address, the critical concerns. And, every staff member has a right to be concerned when there is a program or a project in play that might impact how they do their work. So it's really important. Then it's important to make sure that that team has the time, the tools, understands the guardrails, what is the vision and the scope of this project, and understands the expected deliverables and timeline. And then assigning them a really skilled facilitator to help them with that is also key. And finally, it's been mentioned before, but you can't say it enough, deploying early and often a change management strategy that makes sure that a robust communication plan is implemented to ensure both transparency and encourage discussion, because through the process of people speaking to each other, talking through what their concerns and what their thoughts are about opportunities are, that's how you get that overall engagement and commitment to the change and to the program.
Mm-hmm. Absolutely. And to your point about establishing early wins, I think that also helps boost morale and maybe some trust in the program as well amongst staff, because it's always good to have an early win. So Laura, what are your thoughts?
Yeah, I'll just add to what Christine and Yuri have mentioned, but what is the problem you're trying to solve at your organization, but also look to your communities. Is it a rural facility that has a workforce challenge? Really look outside of your walls as well. So aligning with your organizational strategic plan, taking that a little bit step further, and then understanding what are those key activities to drive those outcomes. Your results should come organically as long as you have that true north at the core of all you do. I think early engaging also with data science and IT, of course, with technology is critical. Looking at your workflows, workforce and work environment, which are part of your strategic plan, and AI and virtual nursing capabilities just power it. Absolutely.
So kind of to touch a little bit on the nitty-gritty details, obviously introducing any technology will change workflow for the day-to-day for bedside nurses. So how can CNOs redesign those clinical workflows to effectively integrate AI and virtual nursing models so specifically they don't interrupt care delivery? If Christine, you want to get us started.
Well, gee, I think that's the $10 million question, right? How do we do this effectively without creating friction somewhere else? I think that is so very important. And these are the early pioneering days. Although we've had virtual care conversations going for, 20, 30 years, it's now really, square in the middle of acute care. So I think it's important to talk about and avoiding common pitfalls. The first is the timing. When you are implementing a new program or trying a pilot, giving it the appropriate amount of time to really become stable. We know that in complex systems with complex processes, it takes a good 6 to 9 months for a complex process to stabilize. So enabling that to happen while at the same time using rapid cycle improvement methodologies to level set regarding where you are currently, where you're going, what has been the progress, what are the barriers, very, very important. And to infuse that, you need data. It's important to be data-driven, that the data that you're collecting are aligned with your goals clearly, and that you have a very acute measuring stick to know exactly where you are in relation to where you want to go. When you're talking about rapid cycle improvement, we talk about the iterative change, and there are going to be projects that you try, and despite your best efforts, they are not going well, and it's very clear. In those situations, you're going to want to fail fast, abandon the processes that don't work, and move on to the next opportunity. For those processes that are working and you've achieved the milestones and the goals you want to, make sure then that you have a plan for expansion and growth of that program. And then there are going to be those that fall somewhere in the middle, where the processes are working, they might not be stable or consistent, so you might have some adaptive work to do on the improvement front. So understanding, how to apply those principles, making sure that you're using data to drive the improvement, very important. It's also, I think, another pitfall or challenge is that people think that, okay, we've planned for this, we're implementing, and it's automatically expected that efficiency will skyrocket. Well, we know in reality that when you are expecting a heavy lift of the clinical staff, efficiency will most of the time dip initially. Complex systems take time to innovate and change. So let's make sure that the work group understands that they understand that their task also is not just to insert technology and virtual resources into their current processes. We know through the pain of the last 20, 30 years and all of the lessons we've learned from the great impact that our electronic health systems have had, that there also have been a lot of workarounds that have had to occur at the clinical level and at the bedside related to that. Well, now is the time to look at, why we are doing certain things. Is it necessary? Is it value add? And when the answer to those questions are no, we need to remove them and figure out how to streamline the processes, make it more efficient. It's also, I think, another potential pitfall is having your eye on the ball for what you're looking at without understanding that there could be downstream impacts that you might not realize. So the goal is do not create a problem that didn't previously exist. So to do that, you need to have data, hopefully, that are being captured in an automated way that can look at every step of the process and give you some very early indicators if something that you may not have anticipated is actually changing. So to do that, as has been previously mentioned, involving your informatics and IT folks early on, making sure that your data streams are designed to be able to help you track your success and use timestamps for workflows whenever you can, so that you can really get down to the detail.
Mm-hmm. Absolutely. And Laura, what are your thoughts?
Yeah, I'll just add that it's not about recreating necessarily your workflows, but it's really about fully integrating that care delivery model to coexist to create that care model of the future. So I think, that's really important for us to recognize, as it's really about the future care delivery model to not only support our patients and our communities, but our teammates, our clinicians that are working alongside. Testing workflows certainly is important. Measuring the success, of course. I would be remiss if I did not mention measuring and using the data, but I think it's really about the coexistence.
Mm-hmm. Absolutely. And Yuri, what are your thoughts?
So I would say every time we look at a different piece of technology and we're going to implement it, I would say make sure we don't have competing priorities. Competing priorities, I think, takes the focus away of what you're actually trying to do. And I have to say, listen to the staff as you start to implement, because they're boots on the ground, they're on the front line, and they understand and they see what's going on. And if we want their buy-in, I think it's super important to keep listening, have regularly scheduled meetings, make sure that we're in tune. Go back again, I think, to what was said before, make sure you have good personnel in place that are managing the process and helping to document and helping to eliminate what those barriers that seem to pop up. I mean, change, I think, is always painful in some way. And we're in, I think we're at the beginning of the technology revolution. And I mean, I don't know how many of you remember when we used to paper chart in the past and how painful that was, going from paper charting to electronic documentation. We're going to have some of that pain, but I see the benefits of everything that we've done in the past, and every minute of it was worth it.
Absolutely, yeah. And I think you're 100% right. This is just the beginning. And even as technology changes and grows on its own outside of healthcare, it's definitely going to have an impact on the industry. So speaking of the nitty-gritty with the technology specifically, how should CNOs collaborate with IT and executive teams and other clinical stakeholders to set up AI and virtual nursing for success while still prioritizing the nursing workflow and patient safety? If Laura, you want to get us started.
Yeah, that's a great question. And Yuri, I certainly remember paper charting. If I could have only imagined 20 years ago where we would be today. I mentioned earlier, workforce, workflows, work environment, they are all key to the success. But we could not do what we're doing without our great key stakeholders from our ancillary teams. So our IT, our physicians, respiratory therapy, HR, compensation, you name it. I'd be remiss if I missed many of them here today, but really involving them and prioritizing it in the work that we do, from our physician to our C-suite. Creating that shared vision is key. From day one, whether it's through a charter or design session and brainstorming, creating those clear priorities is going to help build that trust. And being very transparent along the way certainly is really important to update the teammates and the executive steering committee. Whenever I implemented a new site with my team, I am firmly believe that you need to have standardization. So daily, even during go live, but even prior to go live, you're engaging those key stakeholders from IT to the nursing stakeholders at the unit level, weekly, then monthly, forever. In sustainment, if you don't keep your eye on it, certainly it could fall short. So you want to make sure that you engage those key partners forever. And I think that sometimes that's where you go wrong with sustainment is, it falls off the plan and then you don't connect necessarily with the facilities. And we do not do that at Advocate Health. We continue to meet with them monthly, regularly, forever. So really important to have that standard work.
Absolutely. And then Yuri, what are your thoughts?
I would say always engage your strategic key partners on your IT team, because a lot of times we have ideas and things that we might want to implement, and we go down the road of investigating it without our partners, and only to find out that that is not feasible on our system. So I think everybody understands the security issues that we have across healthcare right now, and IT is one of our biggest partners when it comes to keeping our system safe. And it really helps to have strategic partners to help tell your story when you're looking to implement a new piece of technology and how that's going to benefit the system. And then I think you have to assess what your organization's appetite is at the particular moment for implementing a new technology, because the cost of that usually comes out of IT budget when it's going to be budgeting. So understanding what that is and being able to show what that ROI is going to be, I think it's super important.
Mm-hmm. Absolutely. And I love your point about cybersecurity, because that's also obviously a huge issue. Anytime there's something new introduced, that's always a concern. Christine, what are your thoughts?
I think my colleagues have covered this topic pretty well. The only thing I would mention is when we're talking about the focus being on, obviously systems need to talk so that data can flow from one area to another, but making sure that we are laser focused on the impacts of those decisions and how it actually impacts individuals who are doing work at the bedside. When I think about some of the lessons learned from the EHR implementations, one of them was that through nobody's fault and through no unintended poor will, decisions were made that had substantial impacts to nurses in particular, and to a point where today we have such complex workflows that really have pulled staff away from the reason they probably went into nursing to begin with. It's taking people away from the bedside. When I've seen statistics that show anywhere from high 30s to low 50%, up to 60% of time a nurse's day is spent in administrative tasks and away from the bedside, that obviously varies. But that tells me that we have real great opportunities. And usually that starts with the question and the need to make systems talk to each other. So making sure, again, that we are involving our shared governance teams, and that we have input, and that there's a clear line of sight to what a decision means all the way down that cascade through the workflows, I think is really important.
100%, yeah. So we're going to circle back to change management now. I know each of you have kind of touched on it already, but I would love to get into the details of that. So what are some change management strategies that are the most effective for nursing leadership when implementing new digital health models. If Yuri, you want to get us started?
I would say one of the first things we do when we're looking at another type of technology is trying to assess whether the nurses are working at top of license or not, and removing the tasks and the things that are really not at top of license. And I think virtual nursing is a great opportunity to do that, where we can move some of the administrative work or some of the easier work to someone that is not physically on site, to keep the nurses at the bedside doing the things that we really need them to do, and the things honestly that they enjoy doing the most. I appreciate hearing that there are some studies that show that sometimes 40, 50, or even 60% of the time is spent documenting. And from a nursing perspective, that's not where the nurses want to be. And they know it has to be done. I mean, nurses have been taught if it's not documented, it's not done. And we understand those pieces, but they would really rather be spending time with the patients, taking care of patients, and improving outcomes, quality, safety, and experience. So looking for ways to help them work at top of license. So doing that evaluation and seeing what can be moved off and what can be moved to technology.
Mm-hmm. Absolutely. Christine, what are your thoughts?
Agree with Yuri more. Making sure that people understand how this is going to impact their work is paramount. And we focus a lot on staff, which is absolutely essential. We need to equally focus on leaders. A lot of our leaders, just like our bedside staff, the average tenure is dropping from what it used to be. And not every leader comes, with a full toolkit knowing how to manage change. So ensuring that the leaders that you have charged with supporting you as the executive to lead that charge and lead that change, making sure that they have the tools that they need, the resilience, the support. And so I am a very huge fan of the very simple change management tool, ADKAR, a PROSI tool, that talks about awareness and desire before you actually tell people how to do it. And, pulling those levers of helping people understand why we're asking for a change, and then giving them information about what would happen if we don't implement this change, and why should they want to change. So what's in it for them and what's in it for their patients. That's where allowing them to lean in and say, yes, I'm committed to this, I will support this, before you start with talking about how you actually do the changes is really, really important. I think the need for the executive champion to be visible here is so very important, and for their direct report leaders as well, and to infuse storytelling into the process. I was at the Wisconsin Organization of Nurse Leaders Conference this last week and spoke about the use of storytelling and how powerful it can be in the change management process. In my mind, it's essential. And that is because there are going to be things that don't go well when you are implementing a major change. And you will know that there will be those stories that are happening, the sidebar stories about what happened. The buzz will be there. Leaders need to have their ears squarely to the ground to listen in for those and make sure that they are part of the conversation, so that they understand both the concerns, what is known and what is not known. In my experience, oftentimes in the lack of true information, people create the rest of the story themselves, and that takes on its own life. So making sure that there's full transparency when something didn't go well, and equally when something goes very well, and then that there is conversation about what else happened, what the rest of the story is, so that people can understand. And this is when leadership being a bit vulnerable themselves and saying, hey, I didn't expect that. When you can show your true vulnerability, but continue to lead, I think that is something that is well respected. Brene Brown she uses the concept of rumbling, which is, being able to hold high stake conversations effectively, particularly when positions are polarized or emotional. It's so very important. And I think that being able to feel comfortable in that sometimes uncomfortable space is really important. So I think those are key pieces to the whole change process.
Mm-hmm. Absolutely. Yeah. And I could not agree more with the transparency thing, because you're totally right. When people don't have the full story, they'll fill it in themselves. So that's super important. Laura, what are your thoughts?
Yeah, I'll take that another step. Ask the team what change is needed. Reach out to see what is the problem you're trying to solve versus come to them with this is the change. I think, that's the foundation of all we do. But have fun, understand what they need and engage them. Have them visit. If you have a virtual hub, have them touch the technology, test out the equipment. I think the more hands-on you can get early on and engaging, whether it's a frontline clinician, a physician, a new IT partner, getting them involved to see and hear what the technology looks like, certainly is going to be a great foundation to any change, but in particular, AI and virtual nursing. Transparency, Christine, I love that you said, engage them and don't be afraid to get out of the C-suite, right? Roll up your sleeves, champion the change, grab your professional governance leaders and take them right alongside with you. In one of our first meetings with our hospital leaders, we say, please bring your chair, your professional governance leader right along. We want them in the meeting. We want them embedded in any change that we do. We invite them for their feedback. We want to know, it's a gift, what's working well, what's not working well. And I think that standard work certainly creates a foundation. And it can't be cumbersome or challenging. So involving them, but have fun while you're doing it.
Absolutely, yes. And as a reminder to our audience, if you're participating in the live program, feel free to submit a question. You can do so by clicking on the Q&A widget at the bottom of your screen. It might already be open and appear on the left side, and your questions will remain anonymous. So as a follow-up to this part of the conversation, it was mentioned earlier as well, but I want to talk about staff skepticism and resistance, specifically towards AI. There's been a lot of, buzz about that, especially in 2025. So what are some strategies that CNOs can use to address and reduce staff skepticism or resistance towards AI-driven care models? If Christine, you want to get us started.
I think it's important, as both of my colleagues have mentioned, that you first need to listen to staff and listen in to hear what their concerns are. I think it's important to instill confidence, as I mentioned earlier, that we have governance structures in place and we have clear strategic visions on how we're going to deploy both AI and virtual care. Then, I've said it before, but it can't be underscored enough that the metrics need to be clearly defined in advance and measured throughout. So data must be consistently available so that processes can be monitored, throughout that time. But getting back to the AI component, I think that there's a lot of healthy concern about what it means. And I think organizationally, making sure that you have a single leader who is accountable and responsible for the AI strategy in all areas of the organization is really an important step. And when you're dealing with overall the whole concept of ROI, as you asked about, G, it's important that you realize that you should have in the technology partners that you've selected, they should be able to walk side by side with you and provide you with useful tools that allow you to not have to reinvent your own resources, but talking about calculators that help you flesh out ROI, not just from the individual measure or measures that you're trying to develop, but there are a lot of lagging measures. When you're looking at, for example, I'm working with an organization right now in the operative space, and they are implementing virtual nursing to try and drive throughput. And they have a goal of reducing 10 minutes off the front end of the peri-op experience and 10 minutes off the back end, and they have a dollar amount assigned to that. But looking at other softer goals that might not be evident right up front, but could lead to improved nursing resilience. They have lots of manual and paper processes embedded in their system. So as we help them declutter, what is the impact to the staff, their ability to do what they need to without having to do these, redesigned workovers or, the duct tape processes that have been created, turnover, resilience, I've said, and then also looking at the younger nurses and how they are learning to thrive. One of the most concerning metrics that I am hearing about is the percentage of staff who are deciding to leave the profession within the first 1 to 2 years of actually graduating. That to me is a crushing indicator that we need to do some things differently. So how we're measuring our ROI also needs to ensure that we're looking at our most valuable resources, which is our staff, our teams, our people, and making sure that we are addressing their needs as well.
Mm-hmm. Absolutely. And Laura, what do you think?
Yeah, this is a great question. And I think, if I'm being honest, we know that skepticism exists. So I think it's really important to understand the why. Go to the units, the departments, understand exactly what their skepticism is. Is it about, patient workload? Is it about patient experience? And also involving, I'll take this another step further, the patient experience councils to see what skepticism there may exist outside of our walls. I think that's really important. But doing that deep dive, whether it's through selection of vendors or, involving teammates or physicians in the products that we're choosing, but understanding the root cause of it, I think is really important.
Absolutely. And then Yuri, what are your thoughts?
Yeah, I find that a lot of times skepticism comes from uncertainty and really not knowing what the new technology is going to do. And there's also a healthy fear of, is this going to create more work for me instead of less work for me? I think people always consider that. How much work am I going to have to put into it? I think another thing that we have to really focus on is there is still an underlying piece of how far are we going to go with technology, and is it eventually going to replace some of the nursing personnel? And so I think it's talking through all of those things and having them understand. You have to have cheerleaders out there, and I think you have to help the staff understand what they're really doing. They're really setting the pace for the future. And they have a fantastic opportunity to set what is coming in the future for their organization, for their units, and to set the standards and to have the opportunity to be the first to be able to design what is coming for the team. So I think giving them the why behind it, helping them understand the why behind it, and helping to alleviate, I think, some of the fears that may go with technology as it continues to advance.
Mm-hmm. Absolutely. And so we've talked a lot about ROI already, but I want to get into some of the details about that as well. How can CNOs evaluate ROI and patient care outcomes associated with AI and virtual nursing? And what are some of the metrics that y'all are maybe using to do so? Laura, if you want to get us started.
I love this question. My team will say, data tells us stories. And I think, we're really trying to execute what is the data trying to tell us about it. So metrics for success always start with people. So people first. We measure at Advocate Health every pre and post implementation, not only about the program, but about how the implementation went. Learning from your experience, every hospital or department. Certainly we evolve over time, but I would say people first always. But other metrics that we look at are, retention and turnover, of course. We want, outside of the subjective feedback, we also want to know if the data, our HR data, is telling us what we believe. But also, quality, safety, patient experience, of course. But also we look at falls, we look at sitter utilization avoidance, readmissions, length of stay, patient experience, particularly in the nursing communication and overall likelihood to recommend domains, throughput. And then we also do deep dives into nurse-sensitive indicators. So, making sure that those metrics that our virtual nurses have a direct impact on. So your falls, your CLABSI, your CAUTIs. But, certainly it's taking all those metrics that we know any unit leader should be measuring for the success of their department and our patients and teammates, but really taking a precisional micro lens to compare those pre and post.
Mm-hmm. Absolutely. And Yuri, what are your thoughts?
I say all of those things that Laura just said, and a couple of the things that we like to look at is we first ask the team, what do you think we're going to gain from implementing this technology? And certainly a lot of things with efficiency go with that, right? Efficiency, more time, like order to exit. So has the technology decreased the time that it's taking you to discharge a patient? Has it provided some of those things for you? And the other thing that we try to look at as well is by implementing technology, is it decreasing their documentation time? And if the documentation system that you use allows you to do that, you can actually see the decreased documentation time by nurse for the implementation of that program, right? So you want to know when it went live on that unit, and then you want to be able to see if you can gauge. And you can usually see with that type of monitoring which are the early adopters, which ones are actually using it, which are struggling, which are not actually using the technology as much. And then it really gives you the opportunity to ask questions and then to, prod a little bit. Where are the challenges? How are we working on it? Do you have feedback for us? Where do we take that feedback to? And then how do we get those changes implemented in order to make it the product that you really want it to be?
Mm-hmm. Absolutely. And then Christine, what are your thoughts?
Yeah, I love leading with people. That is so very important. I think on top of that, then, the patient is at the center of everything. So looking at the safety metrics, looking at the operational metrics, did we cause them harm? And if so, why and where and how? And what are we doing to mitigate that? Avoidable injury, readmission, complications of care post-discharge. Are we preparing patients for that transition? All these metrics are so very important. And we need to make sure that, again, we are looking at the whole process and that our outcomes in one area do not have either a negative or a degrading impact on something else. So it's really being holistic, I think, with how you look at your whole outcome evaluation. I think I absolutely believe that staff can really drive. They will determine the success if we have not done our due diligence at connecting them to the why, managing change, and having those rumble conversations when somebody just is, upset. We know that change causes friction. Most people are resistant naturally to change as human beings. So what do we do to get people excited, and making sure that we are measuring how each intervention designed to embrace that program success has actually landed. And when it lands well, make sure that it becomes a part of our standard process for change management. When it doesn't land well, figuring out why. Because the more we unravel and unpeel those layers of sophistication of what caused success versus failure, the more we'll understand our organization, its culture, and how to impact change. So all of these metrics combined need to then, be served up in that metric salad, so to speak, so that we all are understanding the full impact to all of our pillars and all of our resources.
Absolutely. Well, we're coming up on our Q&A time here. So thank you all once again for this excellent discussion. This now brings us to the Q&A portion of the program. So we would now like to invite you in the audience to ask live questions of our panelists. As a reminder, if you're participating in the live program, to submit a question, click on the Q&A widget at the bottom of your screen. It may be open already and appear on the left side of your screen. Please note that your questions will remain anonymous and will not be viewed by other audience members. So we've got a couple in here. So first, as you move forward developing a virtual nursing program, what do you use to measure productivity? If Yuri, you want to take this one first.
Yeah, some of the things that I think I mentioned prior is efficiency is a big deal, I think, for most organizations, right? You have a constant flow of patients coming in and out, and the staff let you know where the bottlenecks are. So if you implement technology, so something specifically like virtual nursing, are you taking the edge off of them? Are you allowing them the amount of time that they need in order to facilitate some of the throughput and efficiency metrics, like your door to discharge times, and again, are you saving them time on documentation so they can get to the next patient? Do you have patients that are waiting, like if you have a surgical unit and you have virtual nursing on a surgical unit, are the patients waiting to get to the surgical unit? Those are the type of things I think when you're looking at how to measure some of the things that you're trying to address with the implementation of the technology. You know where you were when you started. You may see a dip when you first implement the technology, because I think that happens a lot. And then as you start to get better at it, you start to see the gains that you're looking for as you implement it.
Absolutely. And Laura, what are your thoughts?
Yeah, I'd love to add to that. So I think it's really two different buckets here. It's the productivity that you would hope that the frontline clinicians are seeing. You know, they're clocking out on time, they're able to step away to, take their lunch uninterrupted. And then it's also measuring the productivity of your virtual nurses behind the camera. And I think in that part, so at Advocate Health, we have two different virtual nursing care models. One is admissions and discharges to concentrate on that throughput. And one is a comprehensive 24/7 model. But in either way, we're looking at total patient encounters. All of this technology that we have, we're able to see, how many times those cameras have been accessed and how long those encounters were for. And so therefore have been able to create benchmarks to ensure that our teammate is productive. And certainly you would hope to see those metrics align both in the department level and from the virtual nursing hub. So that's a great question.
Absolutely. And then Christine, do you have anything you want to add as well? I think you might be muted one more time, so sorry.
There we go. Just to drill down on what Laura said, very comprehensive responses. I would just say, looking at, if you want to get down to productive numbers, you are looking at the activities that you're asking the virtual nurse to do, determining the average time it takes to determine how many encounters you want them to be able to do within the time frame that they are staffing. And then you can start with your productivity metrics. Obviously, there's an acuity factor to that, that as you understand what types of patients, whether it be by diagnosis or by provider or by age, you can then drill down to see the various stratifications of impact to efficiency. So it's kind of an iterative process. Looking at the data that you collect, you can start with a benchmark of what you anticipate, much like you do when you budget, and then your real data come in. You can see the impact of the virtual nurse to the bedside nurse's experience, as Yuri mentioned, and then look at the throughput metrics. Where are there still barriers or lags in throughput, and how can the virtual resource impact those lags, and then again iteratively building in on where the process is improving, where it might still be lagging or failing, and then through your quality improvement PDSA model, iteratively looking at how to close those gaps.
Absolutely. Okay, we've got a few more questions. This is a good one. How do CNOs ensure accountability so that patient safety and outcomes remain the top priority rather than financial ROI? If Laura, maybe you want to take this one first.
Yeah, that's a great question. And I think with any accountability, it's about creating a psychological safe environment. I think that, we've talked a lot about standard work and we've talked a lot about ensuring that we have the metrics for success, but I really think that that's the root of accountability, is where you have the environment where your culture is just that, where your teammates from the front lines to the C-suite, we all have the same foundation and goals, whether tied to the strategic plan and the execution of virtual nursing across your organization. I would say, you have to have that environment as the foundation. So asking for feedback, every day, not just when your meetings are scheduled, and that will definitely go a long way with your culture.
Mm-hmm. Absolutely. Yuri, what do you think?
I 100% agree with Laura. I mean, everybody manages now and they gauge their safety metrics, and that should not change when you implement. Actually, you would probably look at them a little more tighter. But one of the key factors I just want to highlight that Laura said is you have to get the feedback from the team on what they're anticipating or seeing as a potential safety issue, because safety is always going to be paramount to what we do, right? We do no harm. That's really what we're to do as healthcare organizations and as team members. And I don't think there's a single staff member that wants to know that they're implementing something that could potentially cause harm. So when they have feedback, we have to take it seriously and we have to investigate whatever their thoughts are on those types of processes that we're putting in place. And I think it's really important that we monitor the same things that we were monitoring before and then look for changes and trends.
Mm-hmm. Absolutely. And Christine, do you have anything to add as well?
Gosh, well, the challenge and the opportunity with accountability is probably one of the top priorities of all leaders. And I think that it comes down to how well you've created that relationship where your staff feel that they have a trusted leader that will hear them, listen to them, advocate for them, but also, when the time comes, say, hey, this is what we need to do, and this is why. I hear you, and this is what we'll do to address that particular concern, but this is the direction we need to go. So having that vulnerable leadership, somebody who has the tools to be able to address and mitigate when some of the anxiety is elevating. And when things go wrong, I think that's when a really powerful leadership is absolutely essential. Addressing the issues, making sure their staff know that they are valued, that even despite an outcome, that you are looking at this from a systems perspective and not assigning individual blame. Because we all know that the role of the bedside nurse is probably the most difficult role in the hospital. And what is expected of them is something that very few people can do. So it's up to us to help them remove the barriers, elevate them to the top of their game, their expertise, their talent, keep them resilient. No small task for leaders, but it's what we're all charged to do.
Absolutely. Well, unfortunately, that's just about all the time we're going to have today for questions. So in closing, please note that our next program on September 30th will cover the winning edge for solving the data dilemma. A live clickable link will appear at the close of this program, taking you to our registration page for that event. Remember to follow along all week as we cover more strategies for overcoming key barriers to virtual nursing adoption on our website, healthleadersmedia.com. And lastly, I want to thank our panelists so much once again for this excellent discussion, and to our sponsor, Collette Health, for making today's program possible. And finally, thank you to everyone in our audience for participating. We hope you enjoyed today's program, and we look forward to seeing you during our next program on solving the data dilemma. Thank you, everybody.